for Children survey, the EMS for Children survey data in Tableau, which is something that we've all been excited to get to. Just a reminder about our group norms, please participate. We really want to hear from you in the chat. If you have a question, you're welcome to say it over the phone. Just please make sure that you're muted to avoid any distractions. All skill levels are welcome, and we hope you have some fun trying some new things today. Our monthly challenge for July was to explore agencies and pediatric populations in the Map of All Agencies tab in Tableau, and to tell us what surprises you. Patty will get to that in just a little bit as well. So for now, we're just going to go ahead and kind of turn the time over to her and let her show us some amazing things.
Thanks, Jane. It's welcome to all of you. It's so good to see people and hear people. I think, let's see, I hit share my screen, but I don't know what you're seeing. I don't see a red line.
We see your Word document.
My Word document. Okay, let me stop sharing. You can read my welcome statement there. I did practice this. No, sometimes your screens switch up here. Okay, so let me do that. Okay. Are you seeing Tableau now?
Yes, we see it right there.
Okay, usually there's a red line on it, so I don't see it. So yes, welcome everybody, and we're going to go over the newest upload that we put on Tableau. And this is so hard for me because there's so much I want to show you, because data freaks me out with happiness. So especially when we can do it in a visual way. So it's a little bit fast today, but we'll probably do a follow-up pop-up webinar for you in order to tell you a few other things, especially printing and using these for different presentations. So when you go into Tableau, you'll want to go to the Explore button. When you go to the home page, sometimes it will show you things that you've favorited. I mean, you can favorite your EMS Children Surveys folder, but we want to go to Explore because it's the easiest way to see what folders are shared with you. So this time we're going to go in for EMS for Children. And one thing to remember is if it's not a folder, this is called a workbook. This is important when you are printing or sharing things. So we're going to look at the 2022 EMS State Summary Report. So this is a workbook. As soon as we open it, we see all the dashboards. So a workbook contains dashboards. So unfortunately, right now you have to go to the overview page first. We're working on a way so it will automatically go to your state, and I will get that to work. So right now you have to go to the overview and select your state. So I do want to thank Morgan Skaggs, who allowed me to share her data from Kentucky for this presentation. So once you select your state, you'll get some high-level information. So this data in this dashboard is high level, and we apologize that it's taken so long to get to you. We're making some changes with our BI and IT group that will hopefully be implemented here soon and actually help us get things to you a lot quicker. So the overview contains, for you longtime managers, it will look very familiar to you. You do have access to all your prior years if you want to look at those. So we do have your response rate is the very first thing. Then the next important thing we have is the number of records in the data set. I say important because it's possible that your respondent number 98 will be lower here. It could be 97 or 96, because after cleaning, and sometimes what happens is we find that there's several agencies in your data set that said they do not respond to 911. So that may be something you want to follow up on. So this becomes the overall denominator for four of the dashboards in this workbook. Then we have performance measures, which again can change this number. So the performance measures do have exclusions according to the EMSC program right now. This may change in the future, but IHS, tribal, military, air only, water only agencies are excluded from the calculation. So this, if you did survey IHS services, which we absolutely encourage you to do, because that we need that information, or military, air only, it really helps you to see your state. This number may go down, because if you had 2 here, this may say 96. And it would change the denominator just for your performance measure reporting. So at the bottom, you'll see the numbers that go to HRSA in the EHB. And they do also get your response rate information. So then there's 2 other tabs that use the performance measure numbers, and that's EMS CO2 trending, EMS CO3. So we're going to go to EMS CO2 and just explain what this is. So it's exciting that we have 4 years of data now. That's really something we haven't really been able to look at in EMSC. So that's really exciting. And I want to talk to you about the 2 different sets of graphs here, the blue and the red, which tell us information about your performance measures. So the blue side here is looking at all of your agencies that responded to your surveys and met the performance measure. So down here, we have each of the agencies that responded every year. So in Kentucky, this went down, but we also know we had the pandemic through these years. So it, response rates did go down. But so this means 70 out of 98 said that they met the measure for having a PEC, said they had a PEC. So there is a jump here. I wanted you to notice just in Kentucky here from 21 to 73, which seems really high. But Kentucky did participate in the EIC collaborative on increasing pediatric emergency care coordinators in agency among EMS agencies. So that may be something you want to participate in. If we have time, Morgan might be able to say something about that. But also you can reach out to her, I know, and the EIC to find out more about that collaborative. But you can see it's made a difference in her numbers. Now over here on the red side is something that I consider to be more accurate, because we're looking at the agencies that participated in all 4 years. So these are your stellar agencies, and you really would, it'd be great to send them a thank you note, because they are supporting the EMSC program year after year. So 74 of her agencies take this survey every single year. So you see sort of the same trend, but what this helps you know is this is really more accurate in the sense that you're looking at a one-to-one analysis. So you know that you have this jump, but during 2021, some PECs were lost. That could be due to the pandemic and they couldn't be funded. And then in 2022, they're starting to gain some more PECs. So 2 came back. So you can get a little bit information of what's going on, whereas this has different response rates. So we do show you both of these. And this is the same for the EMS CO3 trending. So in the demographics, this is an overview of the demographic questions that were asked to you in the survey, asked the agencies. We do have some filters up here that you can use. Just real quick, the agency type. If you didn't have any of those exclusions like IHS and military, then it will say performance measure agencies only. If you did, you'll be able to select those subgroups and look at it. So this is going to show you all of your numbers and all of your responses. It's not going to exclude anything from here on out, the other dashboards. So you get an overview of the type of providers that were reported on the survey. And this was an optional question. So you may see down here someone who did not respond to this question. So there's one agency who skipped this question. So you can see that in Kentucky, they have a lot of EMTs and paramedics. And you can look at highest licensure, which was required. And obviously, this is clearly an ALS state. So you can get information about that. It can be interesting to look back here over the years and see what happens to these numbers. Just keep in mind that your response rates are different. So you need to be careful on how you report that. We do have a pediatric call volume chart here that we changed from the way it looked last year. And this is because we're really focusing on PECs in both hospital and EMS arenas. in order to show what difference they make. So we have the number of your agencies that see a certain number of pediatric patients per year. So a high volume is more than 600 patients, low volume is 12 or fewer. So you can see in Kentucky, the highest number of agencies is 53, and they're in that medium group of 13 to 100 calls in the last year. And then this was also an optional question, so there is somebody who didn't respond to that question. So this time we added, of those agencies, how many have PECs, and what's the percent of agencies with PECs, so that you could see where to focus your PEC effort. So as you can see here, the high volume and the medium high have really great percentages of PECs. And then we start to go down in the medium and the low. And what I've seen from most of the medical professionals we have here guiding us in EMSC is they like to focus on these medium or low areas to push these PECs up, because these individuals don't see pediatric calls that often, so they might not be as prepared to take care of those children. So they want to have a PEC to make sure that these people are prepared to take care of kids. So if I was Kentucky, it's possible I might want to focus on these 8 agencies first to work with them to get a PEC and so forth. But you definitely also want them in your high volume, so you can choose where to focus your efforts. We did add a map of all agencies this year. So this is a little bit of difference that we've done in order to give you more information. So we took all of your agencies in the contact list system, and what NEDARC team did, the entire team, because we're talking 16,000 agencies, is we went through that list and we really tried to look for an actual address instead of a PO box to make sure it could be plotted as accurately as possible on your map, and also coded in the urbanicity as correctly as possible. So I applaud the team for doing all of that work. So when you roll over any of these dots, it's going to tell you the agency it is. If it says licensure not available or pediatric volume not available, then this is somebody who did not take the survey. If you go to somebody else here, like Georgetown, you'll see they have an ALS in their medium high volume. So you'll be able to see that they did take the survey. And there's other ways to do that. The second thing we included this year is we overlaid the agencies on top of the population in each of your counties. So this population data comes from the American Community Survey of over the last 5 years. And this will be updated, within the next year or two. So it might change a little bit, but maybe not that much. But this will allow you to see, the darker the color, the highest population. So if you roll over a county, it's going to tell you the pediatric population under 18. Unfortunately, they don't include 18 as we do in the EMSC, but you can get an idea of the pediatric population. And in Kentucky, it looks like Jefferson County has the highest population of children of 170,000. And just so you know, LA has 2 million plus population, so that can give you an idea of some of these bigger states and the hurdles they go through. So let's look at if they took the survey. So this is to help you look at the representativeness of the data. So if I was to say, just show me those who took the survey, I can see there's some counties in here where I have no information. And if I look at those that say no, they didn't take the survey, I can see they actually do have agencies. So I am missing some data in an area that I was able to look at by looking at those that did. So there is quite a big area here that I don't have any information about. So it can help you maybe know how to focus your efforts for this upcoming year. So I'm going to uncheck this filter, which you do by going on this little funnel and clicking it, and it will go back to all. You can filter by EMS licensure. So we have BLS, ALS, and not available. So not available is going to show you those that did not take the survey. So if I click on that, I just want to show you that this filter changes to no. So these filters are dependent on each other. So this will help you know that it's not available because they didn't take the survey. So if we want to find out who those 3 BLS agencies are in Kentucky, we can see where they are. And we have 2 urban and a rural over here, a remote, sorry. And I'm going to go ahead and clear that filter. You can also look at your pediatric volume, and it does have did not respond to the question. So this is that one person who didn't answer it, and you can find out who they are by rolling over that dot. And you can not available again would be those who did not take the survey. But let's take a look at her high volume hospital agency. So we see those who responded to the survey. So this changes to yes. And it also changed this to ALS. So I know they took the survey and they're all ALS. So it shows you in what counties they are. And of course, there's one in Jefferson County. So we would expect that to be a high volume. This area had a lot of agencies. Together, these three counties make up about the same number as Jefferson County. So that's why we saw a lot of orange over there. So you can also look at volume and look at that in comparison to other areas on your map. You may find something that surprises you. You may find a county like this Fayette County that has 67,000 and wonder what's going on there. And, are they a medium high volume? And so they are medium high. So you can take a look at this and get the idea for this is for you to get a feel of your EMS system. So I'm going to take that filter off. I want to also just mention to you that these legends are also filters. So I can click on urban and just see the urban ones, suburban, rural, and remote. And then I can roll over those as well. I do want to mention on urbanicity that a lot of times somebody will email us. This is frequent and it's okay. It's a great question, is that they'll say this is incorrect. So there are two reasons why you may think that. One is the address could be incorrect. Two is that there are hundreds of methodologies for deciding if something is urban, suburban, rural, or remote. And we use the methodology that NEMSIS does, which is called Urban Influence Codes. And I highly encourage you to reach out to your TA rep to learn more about that, because the Urban Influence Codes, this is correct according to the Urban Influence Codes methodology. So it looks at surrounding counties and metropolitan areas to decide if that agency is urban or not. So we're keeping in line with NEMSIS, and it's one of many methodologies. You can also come down here and filter by the population if you want to see your small areas. So there's 3 really small counties here in Kentucky. So I'm roll over this and see this one has 526 children. And to uncheck that, I just click on it again. And you can look at, well, what's, sort of my 10,000 to 50,000 area. And you can see those. I did want to mention this does show keep only and exclude. This is for higher analyses, but I actually encourage you not to click on any of these because they will it will actually take things away or exclude something, and then you'll have to log out to get your full data set back again. So ignore those for right now. So then we have the Peck Overview, and this shows you how many answered they have a Peck, plans to, interested in, or don't have a Peck. So your high people you'd be interested in are those who plan or are interested. Right? They're expressing to you an interest in a Peck. So there's 12 that you may want to reach out to if you were Kentucky. And she has, again, a lot that are Pecks. And what you can do over here is if they are a Peck, you can see what they're doing. So the highest 2 here are promoting pediatric continuing education, which is fantastic because this is related to skill checking, which is the other performance measure. And then they're making sure that they're following pediatric protocols. So these are great, right? And then you can see some of the next ones, and ensures availability of pediatric medications and equipment. That's still in the 90s. So these are great. It's going from blue down to gray and orange. Now this other activities here, you may say this is really low, and not all agencies do other activities, their Peck. So that, this is okay. This isn't necessarily a bad thing. But if you come over to this chart here, you can see what those activities are. So as you scroll down, you can get an idea of what they're doing. In this Edmonson County Ambulance, you can see they're working on the STOP program, the mock crash, the ghost out, the 16th birthday bash. They're working with classes at school. So, you know, you can thank these agencies for what they're doing. You can get an idea of agencies that you want to share information with other agencies and so forth. And when you roll over this, it will give you the same information. It's just in a rollover instead of the scroll.
You've got about 9 minutes, Patty.
Okay.
9 or 10 minutes.
And there is a way to print this thing to one PDF so that you can view it. This is just if they oversee, if they have a PEC, do they oversee one agency or multiple agencies? You can look at that. And just quick to show you that if I go to download PDF, a view is talking about this entire dashboard, but it also means you could export individual components of this dashboard. Same with specific sheets from this dashboard, which is what we want to do. We want to export this graph right here. So I'm going to clear all, come over here to other activities, and I'm going to download it. And it will open up a PDF and you can read each one of those comments. A lot of times comments get skipped on the surveys, and we don't want to skip those comments because they give you lots of good information. So you can see what others are doing. So then we have the skill checking overview, and this is just arranged a little bit different from last time. Again, to focus, move the shift of the focus to PECs. So we have a chart here that just looks a little bit different. Here we have those agencies that scored 6 points or higher. So in the EMSC manual, 6 points is considered meeting the measure. And that means in this matrix down here, you have a combination. An agency had a combination here of points that added up to 6. So they could have done 2 or more for skill station and 2 points for simulated, and they get 6. Or it could be that they had all 3 of these for 2 points. So it can be a different combination. But you see here the percentage of agencies that scored 6 points or higher. And again, this is everyone. This would be including your military, your IHS, tribal, etc. And then you can see what's really amazing here is those that have a PEC. So those that scored higher, 94% of them had a PEC. So that's pretty amazing. So this gives you a chance to plead your case for getting a PEC, right? That you're going to help your frequency of skill checking. And then if you look at those who scored less, they have 60%. So this is a really good way to look at that. Let me explain these other charts, and then I'll show you another little magic filter to help you with that information. So we have here what types of skill checking are going on, and these are in the 80%. And field observation is low, which we see across the nation. Then we see the frequency of training. And this bar chart here is very similar to the way the bar chart looks in the nation. So I don't want anybody to be discouraged. So these groups were created by our statisticians. So we have no training at all or very limited training. So these are 11 agencies you might want to reach out to. Those that did 1 to 5, 6 to 8, and 9 to 12. And the median score is 4 for this state. And then you can also take a look at the matrix, which is exactly the same as in the manual. We just put your results. So you can see here in Kentucky, most of them are doing skill and simulated, as we saw above, and this just tells you the percentages that are doing that. And you can combine 2 or more in this and say, you know, these are your top performers. So I just wanted to mention to you 2 things real quick. One is I can go here and say, I want to see all of these graphs for no PEC. Now it's going to shift. So here, all of a sudden, your median score drops to 2 points. We don't have any extensive training performers. Our limited training went up by 20%, so it went up to 71%. These numbers went down, and these numbers significantly went down. So you can start showing your case of no PEC. Of course, this chart over here is going to say 0 because we're looking at no PEC. And there are 2 that did score 6 points, but 26 here did not. So you can really plead your case. And if you look at those that have a PEC, They're still at 4. However, you're seeing your extensive training, which can go up to 12 points, your moderate training, and this limited training dropped from 71 to 47%. So that's pretty impressive to show. And then you can go back to all if you want to. So the very last thing I just wanted to show, thanks to Margot in Indiana, is she did survey her military groups, or air only, sorry, her air only groups. So if you did survey other groups, this will say all instead of performance measure only. So you can come down here and uncheck the performance measure agencies only and look at just those subgroups. This is going to refresh, sorry, because it's been sitting here. So let me go back to air only. And you can see here that she had 1, but they scored 6 points. They do everything, which is exciting. They're in the extensive training, and this should say 12. I need to look why that happened, but I'll look into that, Margot. And then you can see here the reason they scored 6 is because they're doing every single one of these 2 or more times per year. So this is a really great case of actually reaching out to see what they're doing to score so high. You may get information from your high performers to get how to help others. So keep that in mind. So I just wanted to show you that. I know we have 3 minutes left and I talked really fast. I really wanted to show you so much more. But again, keep in mind, this is an overview, a high level overview to share with stakeholders is really what it was meant to be. So types of questions.
If you have a question, you're welcome to go ahead and unmute and ask Patty over the phone, or you can ask your question in the chat. I'll just offer a reminder too that we will be offering a pop-up webinar. More information about that will be forthcoming. It will happen sooner than later, understanding that this information is highly accessible and we want you to be able to use it. We'll be talking about how to download information as well as how to present live from Tableau in your meetings, and that will be exciting. It looks like we've got a question from Rachel Ford. She says, how are you using these data dashboards? Question for the EMSC program managers. If you have a response to Renee, feel free to put that in the chat if you'd like, just about how you're using the data dashboards. We've also got a question from Greg. When downloading a PDF, is the state name on the PDF?
Okay, if you download the entire dashboard, it will, because we have the name on the top of each dashboard. If you're just downloading one graph or one box, like I showed you before, it does not have your state name on there. But you could paste it in as an image and paste it into a PowerPoint, or you can still print one image to a PDF, but if you're just doing one image, it won't have your state name.
That was a great question. Thank you for that response, Patty. We're just about out of time, so I'm going to go ahead and share my screen one more time here.
And I forgot the challenge question, so I apologize.
Oh, sure, that's okay. So we just want to let you know that next month, again, we're going to be starting a new series. We are calling it Changing Your Outlook. And we are going to be going over some information just about formatting and features, messaging, add-ins, and a whole lot more. We'll be doing that over the next couple of months and are really excited to share some new things with you. The monthly challenge for July is going to be to check out the tabs and options in the ribbon at the top of your Outlook or other email client. So if you have a moment and you haven't ever explored that area, go ahead and take a quick peek. It's a lot of really interesting things there that we'll be discussing. If you are interested in checking out our previous Tech Talks or webinar recordings, feel free to go to nedarc.org. We've got a lot of information on there, also on our YouTube channel as well. to view those previous recordings so that you can get up to date with the latest information from the EMS for Children survey, from the NPRP dashboards. There's lots of great things in there. And if you have an idea for Tech Talks, please feel free to reach out to me anytime and let me know what would be most useful for you. Your feedback is important and valuable to us, and we greatly appreciate all that you're doing on behalf of EMSC. So with that, we'll let you go. I hope you have a wonderful afternoon, and we'll see you next time. Thanks, everyone.